on the call. There we go. All right, Yumiko, over to you.
All right. Hi, everyone. Welcome to the fourth and final Lunch and Learn around Family First Prevention Services and claiming. And before we get started, just a huge thank you and acknowledgement to both Angelina Callis and Heather Durasco for envisioning these Lunch and Learn series topics and organizing and pulling us all together to put on what I hope has been a very informative series of webinars here for you all. So today, we're going to take kind of a big leap back and look at the big picture of how Family First and implementation of Family First, how we think it will impact the bigger picture of child welfare funding and at a systems level. So we're going to be looking again at kind of the big picture here and how some of these different pieces that we've been talking about interact with each other and the impacts that they have kind of an overall fiscal landscape for child welfare. And so we have a number of folks on the call today that are going to help walk us through some of the fiscal impact modeling that the state has done. And first, we're going to give a little bit of history and context as to how this modeling came to be. So before I turn it over to our kind of fiscal experts, I'll give just a little bit of history here. So how some of our fiscal modeling first came about was back in February of 2020, which seems like ages ago now. The counties, as well as the state, this was a time where I think there was a lot of anxiety that the state was coming off of the Title IV-E waiver, the federal waiver. We were back in an environment of kind of more traditional 4E claiming, and we were looking forward to kind of being under a new reimbursement structure under Family First. And so I think there was a lot of anxiety and just unknowns about how these major changes around federal reimbursement would impact us overall and the overall financial health of the system. And so a number of state and county folks came together. We locked ourselves in a room in Arapahoe County for several day-long meetings to try to tease some of this out. And we looked at three major areas. We looked at child welfare placement expenditures, prevention services, and then also administrative expenses. And so I know these fiscal lunch and learns have been very much focused on prevention, but because Family First covers kind of the whole continuum of care, both placement and prevention, our fiscal modeling, of course, took both of those into consideration. And that group, kind of the product of this work group, was really development of what we lovingly refer to as the Mitchell model. Some of you, I'm sure, know Ron Mitchell, who was with Denver County at the time. And he helped us create a very robust, sophisticated model that incorporated lots of different assumptions and inputs that allowed us to play around and see the impacts of different things. So, of course, with any model, we have to make lots of different assumptions, and there's never perfect information. And so the model is dependent on what you're putting into that. And so the Mitchell model allowed us to really play around with some numbers and different scenarios in real time. Kelly Saka is going to walk us through more thoroughly kind of what the model looked like back then in February of 2020 and how it's changed to what we know today. So of course, we have a lot more information today than we did back then, as we are on the cusp of implementing Family First now. In general, I will say that initial modeling really helped guide some higher level decision making. At that time, you may remember, we were thinking of opting into Family First early. And some of the things we learned from the fiscal modeling, as well as a number of other factors, COVID just starting to come online and all these other things, we decided to delay opting in early. So that was one of the big decisions that partially came out of this fiscal modeling. But it also started giving us a deeper understanding of some of the different factors and the impacts that they had on the overall fiscal picture in Colorado. And then finally, before I turn it over to Kelly and then Brad, who's going to walk us through the modeling, just a note that, again, this is a fiscal impact model. So we are trying to predict the future. And so a lot of the assumptions that go into the model, we are predicting behavior, right? How many and what, how things are going to evolve over the next several months. So how many kids are going to go into therapeutic foster versus treatment foster? Nobody really knows, but we made informed, educated guesses as best we could so that we all go into the future with some sense of how some of these things are going to play out overall. So I think with that, I'm going to turn it over to Kelly to dig into more about the factors that the original model considered and kind of what's different in today's modeling. So Kelly.
Thank you, Yumiko. Good afternoon, everyone. I'm Kelly Saka, and I'm the Finance Manager of the Division of Child Welfare. As Yumiko said, I was going to walk through a summary of what we looked at back in April of 2020. That's when we completed that modeling for the fiscal analysis, and then compare it to what we know today in August of 2021. So first of all, I'll talk about the placements. We used expenditure data from July 2018 to December of 2019. In this latest analysis, we have updated that expenditure data and are looking at July 2020 through June of 2021. At that time also, we did not have any Qrtps. And now today, we're estimating that on October 1st, we're going to have 230 Qrtp beds. Another issue that we ran into was the IMD issue. We've spent several months talking through that and working with HCPF. Since then, HCPF has developed safe harbor guidelines, and there's a link in this document for you to go back and review or look at if you would like to. But those are the differences between the placements from one analysis to the other. The next one is administrative costs, and in 2020 we looked at 5 different scenarios, and those were like different estimates of how many cases would transition from traditional cases to prevention cases. And we also, one of the scenarios was estimating how many new prevention cases there would be. Another one was estimating how many in-home cases would qualify or transition into prevention cases. Now we have learned a lot more about this, and we are estimating that 3.67% of in-home services qualify for earning the prevention services reimbursement. Also, we are estimating that there's an average of 394 prevention cases per month that will occur. And the next area was the prevention services. We had to, under Family First, we have to estimate or we have to calculate a maintenance of effort before we can draw down any funding. And so back in April of 2020, we had estimated 2.1 million as our maintenance of effort. We have worked with consultants out of Ohio and with Casey Family Programs, and that is, we're now estimating that as 700,000. We also looked at claiming in April of 2020 at 2.2 million. Now we've revised that to 3.1 million. And the match that back then was 1.1 million versus 1.6 million today. Policy decisions were needed on how to allocate the 4E savings or earnings, excuse me. back in 2020. Now, as I believe we've talked about, that there House Bill 1248 directs that prevention services revenue goes into a trust fund and will be distributed from that trust fund rather than going back into the block. So with those three areas of the fiscal analysis, back in 2020, we looked at three different scenarios overall. One was a worst case, one was middle ground, and one was blue sky. The middle ground is what we presented across the state, and it was basically breaking even of 4E loss versus new 4E earnings. Today, we are looking at one scenario, which Yumiko touched on briefly, and Brad's going to go into detail. But we're looking at a $1.6 million gain of 4E earnings. So if there are no other questions about this comparison of before and now, I'll turn it over to Brad, and he can walk us through the fiscal analysis.
Sure. Thanks, Kelly. So hi, everyone. My name is Brad Borges. I'm a fiscal and policy analyst with the DCW Finance Unit. So we've been working to develop a fiscal analysis to understand the impact of implementing Families First in October. For our analysis, we chose to focus on three different portions of Colorado's child welfare funding ecosystem, that being placement expenditures, prevention services, and administrative expenses. So Families First changes federal funding requirements for placement reimbursement. So under Families First, residential child care facilities, group homes, and group centers are not going to qualify unless they're licensed and accredited as qualified residential treatment programs. These QRTPs are high quality treatment focused levels of care to be used only when a child's needs can't be met with a lower level of care. Then at the other end of the spectrum from QRTPs, we have two new levels of care called treatment and therapeutic foster care. So these placement types combine a nurturing family environment with active therapy and treatment provided by foster parents with specialized training. Treatment and therapeutic foster care can be a cost-effective alternative to placement in a QRTP when you have a child that needs more specialized care than a typical foster family home is able to provide. So some of the assumptions that we made for our analysis, you see on the screen here. So we're looking at shifting the bed days for RCCF's group homes and group centers into either higher or lower levels of care. Again, because these aren't going to qualify for federal reimbursement under Family First. So our current assumption is that we're expecting to have 230 QRTP beds available at implementation. That's roughly 74% of our RCCF bed days will be converting to QRTPs. Next, 25% of our bed days from group homes and group centers are shifting to foster family homes administered by a CPA. Then the remaining 75% of bed days from group homes and group centers are shifting to either treatment or therapeutic foster care, with 90% shifting into therapeutic foster care and 10% shifting into treatment foster care. Finally, we also incorporated the new child maintenance rates effective July of this year. Let's jump to the next slide, Angelina. So as you can see in the table here, the outcome of this analysis shows state expenditures falling by approximately 1.1 million, county expenditures falling by about 384,000, and federal Title 4E revenue falling by about 414,000. I do want to note that the reduction in federal revenue is not really due to Family First. It's actually related to the shifting of bed days to cheaper levels of care. And lastly, there's a couple of things that we're not fully able to account for yet that I want to bring to your attention. One is the QRTP daily rate. So currently we're using the accredited RCCF rate, but this placement analysis is going to change a bit if and when a new QRTP rate is decided on. And then also at a later date, a portion of the remaining 26% of bed days associated with RCCF placements may shift into psychiatric residential treatment facilities covered by Medicaid, but we don't currently have enough data to accurately account for moving them at this time, and that's why you don't see PRTFs included in this. Let's go to our next slide, please. So under families, and so this slide is our prevention service analysis. So under Family First, Colorado is going to receive partial federal reimbursement for a limited set of approved evidence-based services included in our state prevention plan. So the new federal reimbursement that we receive will be claimed by CDHS as the Title IV agency and deposited into the Colorado Child Abuse Prevention Trust Fund, which will then be awarded to expand evidence-based prevention services across the state where they may not already exist. So the number of programs and services eligible for federal reimbursement is going to continue to grow and change over time as more services meet the evidence standards established by the Prevention Services Clearinghouse and are added into Colorado's plan. What you're looking at here is based on available expenditures from fiscal year 2021. And the outcome of our prevention analysis shows claimable expenditures of approximately 3.1 million and prevention revenue totaling 1.2 million is expected for the first year of implementation. Then prevention revenue totaling 1.6 million is expected for the second year following implementation. You'll note that motivational interviewing has not been included at this time. We are currently working on a process to capture motivational interviewing through RMS, and this analysis is going to be updated as future earnings become available. Let's jump to our next slide. For our administrative analysis, staffing costs in Colorado are allocated through either 100% direct charge to a single program or via random moment sampling. And what you're looking at here is, for this analysis, uses staff costs allocated via RMS. So the assumptions for this analysis are CFMS cost pool expenditures for fiscal year 2021, a cost pool amount of about 26.3 million, and the RAD unit is currently estimated that 3.67% of in-home services will qualify for Title IV prevention funding. This is an average of about 394 cases per month. And finally, Families First cases are going to qualify for federal funding reimbursed at 50% rather than having a 4E penetration rate applied. Let's go to our next slide, please. So the outcome of our administrative analysis shows claimable administrative costs of 1.9 million and admin revenue of 716,000 for the first year of implementation, that being October through June of the first year, and then admin revenue of approximately 955,000 for the second year following implementation. Let's jump to our next slide. So this brings us to the final three tables of this analysis that you're going to see. The first is the overall changes in Title IV revenue for the state as a whole. Then table 2 is going to show the expected impact to the Child Welfare Services block and core services program. And table 3 is going to show the expected changes to the Colorado Child Abuse Prevention Trust Fund. So with table 1, in year 1, Title IV revenue for Families First totals approximately 1.5 million, with prevention and admin revenue offsetting a small loss to placement revenue. Then in year 2, Title IV revenue totals approximately 2.1 million, again with prevention and admin revenue offsetting a small loss to placement revenue. Let's go to table 2. Table 2 shows our expected impact to the block and core. In year 1, this impact totals 406,000, with admin offsetting a small loss to placement revenue. And in year 2, totals approximately 541,000, again with admin offsetting a small loss to placement revenue. Let's go to slide 3. And finally, slide 3 shows the impact to the Prevention Trust Fund. In year 1, Family First revenue totals approximately 1.2 million. And in year 2 totals approximately 1.6 million. And with that, that brings us to the end of the guided fiscal analysis. So if there are any questions, I would be happy to take them.
It's a lot of information very quickly. So we definitely want to encourage folks to like sit with it if you don't have any immediate questions right now. And you, Heather Dorosco, and I will talk about like ways in which you can get in touch with us or ask questions, that we can get you in touch with Brad or Kelly to talk about some of these numbers if you want to at any point in time in the future after you've had a chance to like digest this a little bit. Yumiko, do you want to add?
I'll just say kind of high level takeaways for me, to kind of continue the theme of where we were versus where we are now. In that original analysis, this is before we had the trust fund process figured out yet, right? So in the original analysis, we essentially utilized prevention services revenue to offset losses on the placement side. And I think what this last slide highlights is through the Children's Trust Fund process, which was presented, I believe, in the very first Lunch and Learn, what it's effectively doing here is protecting prevention services revenue, putting it into another fund, the Children's Trust Fund, and allowing us to reinvest that specifically in continuing to grow Family First eligible prevention services. So I think that's huge, right? And this number here can only grow over time as we continue reinvesting and expanding and scaling services, as more and more services grow evidence and become eligible for federal reimbursement. This number here on prevention services revenue is going to continue to grow. And I think that's really exciting. In our initial analysis, we showed a pretty heavy loss, overall loss, and that was even using prevention to offset losses on the placement side. And so what you're seeing here is that we're coming out about even in the child welfare services block, even without utilizing these prevention services funds to offset losses on the placement side. So I think those are kind of the big two takeaways from me, and just wanted to kind of reiterate how big this trust fund piece is. Again, that we now have an ongoing source of funding specifically for prevention services that are eligible for Family First in Colorado. Anyone else? I totally don't want to put you on the spot, Molly, but she was a huge architect of the original analysis, and she's on the call today, as well as any other county partners that were part of all this work. Just curious if there's any kind of big takeaways or learnings from kind of the before and after picture here.
Yeah, I think I can just add that, part of the driver for that first fiscal analysis loss that we were seeing on the placement side is that we were assuming that we had generally the same placement types and that we were not quickly transitioning them to Family First eligible placement settings. And so I think also a major shout out to our provider community and to our provider services unit and to counties and to Yumiko and some state folks as well for just the tremendous amount of work that's happened in between the last fiscal analysis and this one to create individualized transition plans to move all of our providers to Qrtps or to therapeutic foster homes or PRTFs in some case, because that makes an enormous difference. If the majority of our congregate care beds are now going to be in Family First eligible settings, that dramatically reduces the 4E loss that we would expect to otherwise hit the block. And so that's just a significant piece that I think shows just a tremendous amount of progress and is a tangible benefit to all of the work and perhaps some of the really challenging conversations and planning sessions that have happened over the last year.
So Pamela, I think to your question, how are you defining eligible prevention services? Still only a labeled evidence-based practice, or is this funding allows other current services being used to be funded? So in this conversation, we are talking about the Family First approved services, which would be the ones we discussed in session 1, right? And meeting the requirements of session 3. At least those are the ones that were considered for this analysis. Is that right, Yumiko?
Yes, and Pamela, there's a slight difference in the actual federal drawdown that's represented on this slide that's being presented here, right? So what we can actually claim for federal reimbursement, those have to be on the federal clearinghouse, have some sort of rating on the clearinghouse, and be in our state plan. Now, for the Children's Trust Fund, which is the 4E drawdown that the state receives and then can be reinvested into prevention services, Heather or Molly, help me out here, but the definition is slightly broader there, where we're looking at services that, yes, are eligible because they're either on the clearinghouse and they're in our state prevention plan, but also those services that are being evaluated to eventually be in the clearinghouse. So in terms of the services that are eligible for this kind of reinvestment, we are including those that are also undergoing some evaluation in that definition, as opposed to what we can actively claim for today, which is just those that are on the clearinghouse. Did I say that right, Molly or Heather? Okay, awesome. And again, Heather and Molly and so many helped make sure that that was there. We thought it was really important to kind of broaden just a little bit, so those services that are actively working towards becoming eligible, that those also were eligible for this kind of funding to expand and continue using those kind of very promising practices in the state.
Okay, if folks don't have any other questions for right now, we're going to jump into talking, and it's a good smooth transition, more about what are some potential funding opportunities on sort of both sides of prevention and placement as it currently exists under Family First. So I'm going to turn it back over to you, Miko, and then also we have Dennis on the line who's going to introduce himself, and they're both going to talk about these things for us.
Sure, and I just see that Margie put in a question in the chat, which I think is a really good one that maybe we can talk about here before we go into the funding opportunities, and it's good to have Dennis on the line for this one too. So her question is, will there be enough trained foster care placement settings available by October 1st? How will assumptions versus reality be monitored? So for example, how will the actual impact to individual families and children be monitored here? And so curious for folks, I think there's kind of two questions there. How are we ensuring that we have enough capacity at kind of some of the lower level family-based care settings? And then also, how are we going to continue monitoring data as we start implementing?
So, Emiko, did you want me to address that? I mean, I can't do the data part, but.
Yeah, I'd love to hear your thoughts, Dennis, at least on that first part.
So on the first part, there was a foster care work group. It's still meeting to finish up its work. But what we did was we looked at foster care in a couple different ways. One way that we looked at it was, how can we, we've had treatment foster care for a few years, but we've had very few treatment foster care beds. How could we beef that up? How could we make that more viable as a level of care? Then we were also told to write rules for therapeutic foster care, differentiating that from treatment foster care, and also create a rate for therapeutic foster care. And then the other thing we did was we looked at foster care rates, and we broke those up by age ranges. So when we did that, we tried to incentivize folks to serve older children and youth, because what we know about our foster care continuum is we don't have a shortage of foster care homes that will accept younger kids like 0 to 3. So we need to incentivize folks to take older kids. So as we did that, we raised the rate in foster care based on the ages of the kids. There's 3 different tiers now. I don't have that in front of me, but I could get it if folks are interested in it. It is now, these are base anchor rates, and they're now in trails. And then we looked at the therapeutic foster care rate, and we set that rate. And that rate, I think, came in at right around $178 a day for therapeutic foster care. In therapeutic foster care, you can have up to 6 children or youth in a home. And then we looked at treatment foster care as well. And we just brought that rate up to the RCCF rate, the former RCCF rate, which is $229 a day, because we figured the work group decided that it was an alternative to RCCF level of care. So we're really hoping to incentivize folks to come to the field with that, as far as being willing to become foster parents. So at this point now, we're looking at our various different recruitment efforts for those different levels of care. And what I would say about that is, are we going to have enough of those types of placements on October 1st? No, we're not going to have enough of those. But what we also know is we don't have to have a number of those types of placements on October 1st. And the reason for that is because children and youth that are in their current placements can remain in their current placements after October 1st, and they're still 4E eligible. So we have a runway of several months before we're going to need that number of foster care homes that will serve children and youth that are no longer going to be in congregated care settings. So that's where we're going to really focus our recruitment and retention efforts around.
Great, thank you, Dennis. And I think that leads right into the second part of the question. And I'm curious, Kelly or Brad, how are we going to be kind of continuing to update this analysis with real data as it's coming in, and how is that going to look moving forward?
Yeah, so as we receive more data, we'll continue to update this. For prevention services, that'll kind of be as more services are added to our state prevention plan, we'll continue to add them to this. I believe it was back on like slide 8 sort of showed the prevention services that we're currently picking up. There are a few more that are included in our plan that we didn't have data to include here. So this is sort of a snapshot in time based on what we have now. And the same thing will work for, it's going to kind of work the same way for placement. So as kiddos start getting placed into QRTPs and we start seeing how that relates to what our analysis looks like, we'll be updating that to incorporate that updated data sort of as we move forward.
Great, thank you. And Angelina, should I answer your question now and talk about funding opportunities? And please keep the questions coming. I think we'll have plenty of time here for some Q&A. So enter those in the chat as they come to you. But we did want to take some time to mention some available funding opportunities related to both prevention and placement, and everything in between for Family First. The first one is, as many of you know, all states received some federal funding specifically for Family First transition. So the state of Colorado received about $7.7 million that we have a few years to spend down. And so one of the opportunities that we put out with some of that funding is a RFA. And we are giving out, it should actually be $500,000 a year over 3 years. So we just closed the second round. So we just closed out year 1. So there'll be 2 more years of this funding opportunity available. And this is really focused on building out the prevention service continuum at the local level. And as Angelina says here, the best way to be informed of that opportunity as future rounds come available is to make sure you're signed up for the Family First Digest. We'll make sure that any funding opportunities, including this one, are communicated there. And then, of course, the second one on this slide is around the Children's Trust Fund. Well, that's really going to be the fund moving forward, where there are additional funding opportunities and grants available to continue expanding prevention services across the state. So those are currently kind of the 2 main pieces we have available for prevention. Actually, well, the Children's Trust Fund's not available yet, but will be once that process is up and running. And then the next 2 are more around placement. Dennis, do you want to mention what funding is available for some of our placement providers?
Sure. Okay. So we just now published 2 different RFPs. Those RFPs are for hard to place, high acute children and youth. They are to give us hopefully like 15 to 20-ish beds so that we can place hard to place youth. And what that would look like is we are encouraging providers to apply for the RFP. Tell us like the rate. If you're a PRTF, tell us the rate you would need to serve those children and youth. If you're a Qrtp, or you're going to be a Qrtp, tell us the rate that you would need to serve those children and youth in your facility, and then we're going to look at the bids when they come in. When we award those contracts to those providers, what it will look like is the department will pay for, let's say the Qrtp is a 10-bed Qrtp. I'm just throwing out a number. The department will pay the provider for those 10 beds for 365 days of the year, whether or not we have a child or youth in that bed. The county will not pay any portion of the rate for the children and youth that go into that facility. So it'll allow the provider to know what their budget is and have a sufficient rate to staff to the level they need to staff to serve the children and youth. So there's just the 2 RFPs are one for PRTF level of care and one for Qrtp level of care. Additionally, we are from a different Senate bill, 21-178. Actually, don't listen to that number. I might have got that wrong. We are also expanding what right now we have 10 IDD beds out at Laredon. We are going to expand that to another 10 beds at another facility. So we have money to create those beds as well. And that RFP is also going to be going out soon so that we can expand those services. And it'll look the exact same. It'll be the exact same model that I just explained. The department will pay the daily rate for any child or youth that's placed in that facility. The other thing I want to add is the department makes decisions on who will get into the facility. The department decides what the wait list of those facilities will look like, because we know they'll have a wait list. And the department also decides discharge dates for the children and youth in those facilities. So it's not really that the provider has, it's not really that there's a no refusal. It's more that the department makes the decision on who gets accepted to the facilities. Oh, thanks, Gretchen, for getting that in there. Lexi had a question, but it disappeared from me really quick. So let me go look here. Let's see.
Dennis, I was just surprised to hear it's only going to be 10 beds in the new contract.
So let's, no, I was just throwing out a number. So let me go over all of the beds that we will be getting. Okay. So right now we have 10 at Laredon out there right now. We're going to expand that by another 10 beds. So that, and then we have these other 2 RFPs that should get us 15 to probably, depending on the rate that the bids come in from providers, maybe 17 beds more. So if you add the 17 beds to the 10 new Laredon type beds, that's 27 new beds that we will have, not 10. Does that answer your question?
Yes, thank you so much.
Okay, so then with those 10 beds, then with the other Laredon beds, we'll have at that point 37 beds that are controlled by the department. So we feel reasonably good at that. About that, we do know the department has heard in many different forums that maybe 27 beds is or 37 beds is not enough. So we're working on alternatives for that. But I would like to point out 3 years ago we had 0 beds. So I think we're hopefully making some progress. I'll pause here to see if there's any other questions around that. Yeah, when I say the department, I mean CDHS. Sorry.
And Dennis, just to clarify, those 2 RFPs are not yet out, are they? Or are they already
Yeah, they're published.
available?
They're out.
Oh, they are.
And we've
Okay.
also communicated that to our provider networks about, and we've reached out to providers individually to look at the RFPs. They have been published.
Great. And then there's 2 additional funding opportunities that are also live right now. The first one you see on the screen here is, again, using Family First Transition Funds per Senate Bill 21278. CDHS is dedicating 15% of our total transition funding, which is a little bit over 1.1 million, specifically for residential placement providers as they transition to Family First eligible models. So, for example, in RCCF, transitioning to a Qrtp. And then on the next slide, there is also another RFA that is currently live that is $500,000 in transition funds, looking at building out a more comprehensive placement continuum across the state. And some of the things specifically mentioned in that funding opportunity are things like recruiting and retaining therapeutic and treatment foster homes, providing enhanced supports for foster parents and kin families, et cetera. So both of those RFAs are also available. Go for it, Dennis.
Not related to funding, but just on the placement continuum, I just wanted to give a quick update on where we are with Qrtp that I just now got from licensing. So as of today, right now, we have 92 Qrtp beds that are ready to roll today if we wanted to implement today. And then additionally, we have 6 more, we can add 3 more facilities in the next couple of weeks with 56 more beds. So we, at this point, have slightly more than 150 beds that will be Qrtp by October 1st.
Okay. I see there are a couple questions in here. Heather, thank you. I know Dennis, Heather Drosko put a link in the chat to the initial Qrtp analysis, which I think we haven't updated since July. So we might want to see if we can have Amy update that for us, because that's the public facing one. But I'll make sure that there's a link in the follow-up that Heather and I work on. And I think to McKenna's point, and Dennis, you can correct me if I'm wrong, there are not currently any open Qrtp beds. And Dennis, I don't know if you want to come in and sort of like, we're sort of walking this tight line of, you know, when we operationalize Qrtp and when we actually, when Family First actually comes into effect. And so.
Yeah, so they have everything they need to be a Qrtp. Licensing wise, they have their trauma-informed model. They've done all the licensing requirements. They're ready to roll. The reason they're not Qrtps right now is because to get a child or youth into them, you need to go through the independent assessment, which is not going to start, which is not going to do, we're not going to put any of the children or youth through the independent assessment for Qrtps until October 1st. So we will, licensing will transform them from RCCF to Qrtps on October 1st.
Thank you, that's helpful.
Oh, but also, McKenna, licensing's working on a new updated list to get to, I know Heather's asked for this, Heather Drosko, a new licensing list to show you which providers are making the transition from RCCF to Qrtp. We should have that in the next couple of days.
And that'll be at the link that Heather put here in the chat. So I'll make sure that we get that added to the slide deck as well. And so for our county folks also, so you know, that document is inside the independent assessment toolkit, which all of you should hopefully have access to. And if you don't, let me know and I will get it to you. Okay, so here's just some instructions on how to access the funding opportunities we've talked about here today. Mostly the RFAs, right? So you can go to the vendor, is it self-service, VSS? At this website, you don't have to be registered in any way to access the documents. If you have trouble, which we've been hearing from some counties, sometimes, right, like there's internet browser issues or whatever, you can go to these 2 websites and get some guidance and direction on how to pull those RFAs up. Okay, So just a little bit around like wrapping up, because this is our fourth and final Lunch and Learn session. So again, here's the link to where you can access the recordings of all 4 of the sessions. I will do a follow-up email that has that link as well to everyone who's been registered. I also want to note, like, there is a survey link in the follow-up email. I promise it's only 5, like not multiple choice, but 5 scale questions. So it goes very quickly, and it gives us an idea of like what was actually helpful and what wasn't. So as we talk about what potential engagement like this looks like in the future, this gives us a really good idea on what we should and should not include and what you actually find helpful and what is just kind of like us talking at you over your lunch hour. So also I want to point out there is a direct link on the CO for Kids website where you can submit questions related to Family First. And so that's the website right here. I review those personally along with our OCYF, or the Office of Children, Youth, and Families communications person, and we make sure that if we can't answer those questions, they get directed to the right people. So that is a great way to continue to access and engage with us if you have questions going forward. And now I'm going to turn it over to Heather, who's going to help us close out.
Thanks, Angelina. A few final comments to wrap us up. One, the link to the complete fiscal analysis that Brad and Kelly shared today can be accessed in the PowerPoint slide deck. So that's going to go out after the call so you guys can have some more time to digest all that amazing information. I also think it's a great idea to think about how often that we want the analysis to be updated going forward with actual data, and to share that back out with a group with lots of stakeholders like this. So Angelina and I can work with Kelly and Brad to kind of think about the follow-up around the fiscal analysis piece. We'll also be sending out some additional follow-up in about 2 weeks. So look around mid-September, and that's going to be Q&A answers to questions that came up in that second session on blending and braiding funding, as well as answers to a bunch of questions that we received via the evaluation survey responses after each of the sessions this month. And lastly, I wanted to say that although October 1st is our official go live date for Family First implementation, it's very much just a starting point for every state across the country. And I know for us, we've done so much legwork, but it's really, there's a lot to be done and lots more to come. So the work to maximize our federal drawdown for prevention and to continue building out our evidence-based prevention services is really going to be a lot of incremental steps ongoing, and especially over the next few years. So CHSDA and CDHS would really love to continue this type of engagement and partnership just with all of you, and hosting some additional sessions whenever they're needed. So with that, I'm just going to thank everybody for joining us today and earlier this month for this series of Lunch and Learns, and hope you all have a great rest of the day.
Thank you, as always, to our amazing presenters, Yumiko, Brad, Kelly, Dennis, for joining us and letting us put you in the hot seat to share out all of your great work. We, as always, appreciate it. So thank you so much, folks. Keep an eye out for that follow-up email and the list of questions that Heather was referring to.